Hi guys, I'm Danielle King. It's World Cancer Day today, so I just wanted to do a video. A lot of you have seen my videos before. So I was diagnosed with a rare primary bone cancer called Chondrosarcoma in my right femur. I'm coming up to my 9th year since diagnosis, so a pretty long time. On my 3rd surgery, which I had at the end of 2024. So I just wanted to sort of talk a little bit about how, as a cancer patient, how it sort of affects you after the treatment, and some of the mental health stuff. So I try and sort of help other patients. So I'm a patient advocate, try and help people sort of make sure that they are, you know, pushing if they feel something's wrong, not being sort of afraid, as I was of my first team, to basically say something's wrong, I know my body, please sort of listen to me. And I think with all cancers, it's very important to sort of be kind to yourself and realize that, you know, when you get the all clear, if you're lucky enough to get the all clear, it's amazing. So I got my 5-year all clear in May 2024. So me and my consultant were jumping around. We was like, yes, that's it, you know, chance of it coming back are really small now, and we'll monitor you once a year. And then a few months later we found out it was back, and New Year's Eve 2024, day after my little girl's 4th birthday, I was in having a major surgery again, on the same leg. So for me, I think you sort of, the way I look at it, I mean, obviously not every cancer patient, everyone's different and they're allowed to feel the way. I'm always nervous when it comes to scans and stuff. I'm like, look, I'm only one scan away from it being back, which sounds pessimistic, but I think it's important to be realistic. My prognosis is non-curative, which terrified me for years. It's basically because the first surgery went wrong. There was a tumour spill, so I've got cells. So the chances of it not coming back over and over, you know, it's very unlikely that's going to happen. Doesn't mean that it's gonna, you know, I've been lucky so far. It hasn't spread, which is one of my 3-month checks again to make sure it hasn't gone to my lungs. But so far so good. But I think it's really important to sort of the mental health around scans and things like that, and also after treatment. So I get something that they call scanxiety. So when it comes to a major appointment, a couple of weeks before, I'm an absolute nightmare. I could be emotional, could be very ratty. So it's best to steer clear of me for a couple of weeks before. I'm sure my family will agree with that. I'm really lucky. I've got such a great support, and I know not everyone's that lucky, but you still sort of get those moments, especially when, you know, when I got re-diagnosed, it was all full on again. Right, let's get this tumour out. Now you're going to have loads of tests, physio, hydro, all of that. The pain, you know, all of that, get all through that. And then in December, I was lucky enough to find out that I've got no evidence of recurring disease. So I was a nerd again. And it's great. It's amazing. It's the best feeling in the world. And then you start to sort of get those moments late at night, my particular sort of overthinking time. Anyone knows me knows that I very rarely sleep very well. And you sort of sit there and it hits you, you know, now what? You then obviously you can get very overconscious if you feel something, and it's always important, if you feel that, don't ever let anyone make you feel paranoid, because if I'd have done that with my last one and didn't email, then, you know, it wouldn't have been found so early and I wouldn't be here probably. I think it's really, really key for us to be a sort of bit kinder to ourselves, and also our sort of supporters, caregivers. You know, it doesn't stop when treatment stops. I mean, for mine, my type, surgery is the only cure, which is why it's so important to raise awareness for chondrosarcoma, primary bone cancer in general. The rarer cancers are really overlooked with funding. So places like the Bone Cancer Research Trust have been an amazing support to me. They, you know, do fundings, they fund scientists, researchers, etc. Sarcoma UK as well, they work together. And things are sort of moving. There's a rare cancers bill going through in Parliament, thanks to some amazing people that are really sort of pushing to make sure that rare cancers aren't overlooked, because I know there's not as many of us, but, you know, we are still people. We've still got families. I've got a 5-year-old, you know. It broke her to watch me go through it this time. She wasn't around for my previous 2 surgeries, and it broke me watching her. You know, I've got photos of her laying in hospital bed because she wouldn't sleep, because you can't hide it. I had a drain in my leg. you know, my leg was cut to pieces. She doesn't understand what cancer is yet. She just knows that mummy had a lump in her leg that was very sore and they needed to take it out. Obviously, as she gets older, we're going to have that conversation, which I'm dreading, because I don't want her to have to live with that. But it's very important, you know, to be realistic with things, and as open as honest. Again, my personal preference. I think years ago I read something that really sort of resonated with me as a cancer patient. And it was a lady, her husband had sarcoma, a different type of sarcoma, and she basically said, imagine someone's got a gun to your head and you don't know if they're going to pull the trigger or not. And that's what it's like. So it sounds really sort of awful, but that is how I associate it. So it's always there, it never leaves. You're never ever going to have that off your head. You don't know whether it's going to be pulled or not. Is it going to be pulled? Is it going to be a bit pulled? Is it going to be pulled properly? Or is it not? You're just going to get left alone. And I think it's important, as you know, a cancer patient, that sort of share that emotional side of it and the anxiety, you know, all of that stuff. And it's okay to feel like that. I mean, anyone feeling like that, feel free to reach out to me, because as I say, it's, you know, I'm sort of nearly 9 years in. I don't cope with it as well as some people. Some people just move on. But I don't think that that's, when I acted like I'd moved on with it on my first diagnosis, I hadn't. I was really masking it. So I think it's really important to sort of just keep checking in with your own mental health. And it's also, after the treatment, a lot of people disappear. So when you're ill, everyone's around, you've got your appointments, everyone's like, can we do anything for you? And then you get the all clear and it's like, well, aren't you grateful? And I'm like, of course, I'm so grateful. But some days I just want to sit there and go, oh my God, like, you know, my whole life's changed. You know, I'm a different person before cancer, and that's okay. I'm fine with that. My leg is completely, you know, the scars on it really do bother me, and I know that's really shallow. I'm really lucky to have my leg. I'm lucky to still be here, but they bother me, and I don't know if it's because it's a reminder. Maybe because you sort of can't hide it. Obviously, ongoing pain. I've still got quite sort of bad cancer fatigue, but I'm hoping that sort of will start to sort of ease. And I just think it's important for us to sort of all be kind to ourselves. And on a day like World Cancer Day, you know, it's time for us all to sort of come together and support. I mean, everyone gets affected by cancer at some point, whether it be you watch someone go through it that you love, or you unfortunately have it yourself. And I just think it's like, there's so much around this sort of be positive, and, you know, don't be wrong, being positive is great, and it helps your mental health, but when I'm too over the top about it, I sort of mask it. It's been mentioned that I do sort of separate when I talk about my story. It's as if I'm talking about someone else, which is why I don't get too emotional when I talk about myself. However, if I talk about one of my friends I've lost or family I've lost, you know, I'm a mess. And I think it's just one of those things that it's okay to sort of each deal with it how we deal with it, and to support each other, you know, to be kind to each other. So as I say, my inbox is always open. Reach out if anyone's struggling, and also, you know, talk to your team, talk to, you know, if you've got family, mental health supports out there. And I just wanted to, just on such an important date, just sort of do a little thing about what it's actually like to live with a cancer. So if you know someone with it, then, you know, maybe ask them how they want you to sort of support them, because I know I deal with it very different to other people, and I think it's really important to sort of do that. Don't be afraid to ask is my thing. Anyway, thanks for listening. Sorry I rambled on for so long and said a million times, but anyone that's watched my videos know that I always do that when I talk about this subject. Anyway, take care, guys.